Also, before we started, I wondered if either you were recording or if I could record.
I'm recording right now. That's okay.
Oh, that's fantastic. Yeah, no, that's great. Okay, so let me get started, and then I want to make sure that I leave enough time for you guys to ask questions later on. All right, so I'm going to start right at the beginning, and I'll tell you why that's important. So my father is Egyptian, and he was born in Cairo. He was born in a very poor neighborhood of Cairo. He lived there for a number of years. It was a really challenging experience for him. He came here to North America, to the United States on a scholarship. He was one of the only young people who came here on a scholarship. He didn't speak any English when he came to the United States, and really had a hard time. It was not an easy journey. He met my mom, who is an American lady, who also comes from a very humble background. She was the first person in her town in a rural area of New York State to go to college, and she was the first girl to go to college. So the two of them came from backgrounds that had a lot of challenges. And the reason, and also then I was born in Montreal, in Canada. The reason that I shared where my family was from is because I think it connects to a lot of potentially your families as well. And it also informs this, right? I think what you'll see throughout this presentation is this idea of hustling and this idea of the immigrant mentality, which is something I definitely have, or the first generation mentality, where um, to give you the next thing that I want to mention is that when I was growing up in Montreal, I did something. Then this is a picture of Gary Vee. You may know him from the internet. He's quite a popular on social media. He has a concept that I think is really important for young people, and that is to taste everything. Try everything. Make sure that you have a lot of experiences. Make sure that you do some art, do some, work in a bakery, work in a lab, make sure that you've tried everything so that you know what everything feels like. And then you can decide based on that, what is the path that I feel the most called to. So when I was growing up, I did a lot of taste everything. I was a super busy kid. That's my next slide. I was busy. I did a lot of things. I did music. So I played the cello, and I played the cello a lot, and actually got into my undergrad degree, both in music and in science. And I had to kind of pick, but I did a lot of music. I did a lot of sports. I did a lot of art. I did a lot of teaching. And so I really experienced a lot of things and really honed in on what it was that I enjoyed doing the most. So I would recommend that to all young people: taste everything as much as you can. I think it's great advice. Once you finish tasting everything, you have to pick one thing. You have to pick one thing that you really enjoy and that you really feel passionate about to go forward with. And I hope I can share that with you throughout this presentation. So that was kind of my early beginnings. Then I got into my undergrad at McGill University in Canada. Some of you may know McGill. It's a pretty good school. It was hard to get into. It is an English school in Canada. And I got in again, like I got music or medicine or science. I had to pick, and I picked science because I decided I didn't want to play in an orchestra. And I also knew myself that I didn't want to be a concert cellist. So I decided, okay, well then let me try for science and medicine. I did my first year of pre-med at McGill, and I flunked. I did not do well in my first year. I was one of those kids in high school that high school was fairly easy for me. I didn't really learn how to study, and I didn't really understand the commitment it took to get good grades, because the grades were sort of always there. And I also got really caught up in comparing myself to other people. So I saw a lot of other people in my university who were not necessarily trying for medicine, and they were out kind of partying and having fun. And I felt like, why am I not doing that? And it must be so easy for them, or maybe it comes easier to them. Regardless, I didn't focus, and I didn't really know how to focus, and I didn't do well at all in my first year. And so I take this really seriously. Sometimes when you feel like you've failed at something, it's really just the universe kind of pointing you in a different direction. That was a hard year for me after I flunked. Going to medical school was kind of my entire identity, and it was really hard for me to accept that I didn't do well. And I felt like, okay, I guess maybe med school's not for me. Maybe I wasn't cut out for this. Maybe this is not the right path. So I decided to think about what it was that I really enjoyed. And I came upon this. And this is where the stories part that I told you that I really like storytelling, this is where that started. This is a whole bunch of roads, and they all intersect. And what I realized that I really enjoyed was that intersection of culture and identity and political science and economics and history, and how all of that influences health. And so I changed my path completely. I dropped out of pre-med because I thought, oh, I guess my dream of medicine is done, because I flunked, like my life is over. So let me choose something else that I also liked. And I really liked history and political science. So I did African studies actually in my undergrad degree at McGill. And I really enjoyed African studies. I really loved that intersection of culture and health. And so I had really completely abandoned pretty much going into medicine. I had a job that I was lining up at UNICEF. I figured, okay, like that's probably, I'll work for an NGO. That's what I'm going to do. And I had already talked to a few admissions counselors at different medical schools in Canada and showed them my, transcripts and my CV. They all told me, nope, you probably won't make it in. And so really I had kind of given up on medicine. And then I applied one more time, and I applied in French. And I'll tell you why. There's one medical school in Canada that's in French, and the GPA cutoff was just a little bit lower, because my first year followed me, right? It does follow you. And my GPA wasn't at that high because I had this like weight of my first year kind of coming with me. Even though I did really well in African studies, I still had a lot of baggage to kind of drag around, and a lot of like shame from that actually. So I applied in French because that was basically the only place I could get in. And I actually got an interview. But I didn't really speak French. And I didn't tell them that I didn't really speak French that fluently. I had just applied. And suddenly I was faced with, oh my goodness. All right, this is my shot right? This is everything I've been dreaming about, it's coming to this, and I don't speak French. So I had kind of 3 months to get to the point where I could at least have a conversation in French and that I could tell a good story. Because really, the interview process for everybody, regardless of what you're doing, is telling your story, right? And telling somebody why they need you and what you can do for them. And every interview is basically that. It's just depending on who's interviewing you for what is you're going to change your story. But I basically had to come up with a story of why this French medical school should take a non-French person into their school and how I was going to help them and do well if they let me in. And so I had a really good interview. I did get in. And then I relied really heavily on my colleagues because I didn't really speak French. So I was learning French and medicine at the same time. And my colleagues in my class helped me a lot because there were times where I didn't understand what the professors were saying. And I had to take my exams in English because I wasn't fast enough in French to be able to take my written exams in French. So I had to ask for permission to take them in English. So that was a bit of a journey just to get there. And then I also realized throughout medical school, I had this kind of restlessness. I don't want to call it boredom because obviously medical school was very challenging because I was learning obviously language and medicine, but I felt a restlessness that was more because I wasn't really connecting to stories. I wasn't really like, I was book learning, but not really connecting to humans in the way that I really wanted to connect with and advocate for humans. And I realized that that's a really important part of my identity and something that I'm very passionate about. So actually, when I was in medical school, I had the opportunity to go to Kenya to do a medical elective as a student. And I did it in the OBGYN department in a town in Kenya. And I loved it. And I got really connected there, again, because I like stories and advocacy and that junction. So you can see where the African studies kind of comes back. And I actually started an orphanage during medical school in Kenya because there were a lot of kids that I came across that needed a champion. They needed somebody to help them get through school. And in the same way that somebody had helped my dad come over here and had given him a shot to do something more, I wanted to give a shot to those kids too. So that was a really interesting part of my medical school experience. I ended up taking multiple months off during medical school to go work in Kenya and then come back and complete things. And I learned how to run an NGO. So NGO is a non-governmental organization. So I started a charity that was raising funds to support this orphanage. And at one point we had 50 kids that were under sort of my care, which was pretty crazy during medical school to be running an organization overseas. So that was a lot. And I ran it all through medical school and residency. But the reason that I'm telling you that is that it really was about connecting to the things that were important to me. And that was advocacy, giving people a shot, cheerleading for others, and giving back. Those were like the themes that kept coming back in my life. So I think some of you are probably considering medicine pretty strongly. And I want to share with you a little bit about what medicine is. It's a lot of that. It's a really long road. And some days it feels like it's not going to end. And some days it gets really hard, and some days it gets really wonderful. But it is a long road. Some days it feels like this too, where it's really just kind of a lot of work. And you'll excuse the language there, but I think it's a really good message, actually. And there was a lot of times that I wanted to give up. And I remembered all the people who had told me when I was in McGill and had flunked, and all of the people who had told me when I had asked the admissions counselors to look at my transcript to go to medical school, and they told me I'd never make it. I thought about them, and I thought about my family and what it took for them to come over here when it was really hard and they didn't speak English and they were lonely. And I remembered that, and I didn't give up. So you have to sometimes find the thing that's going to connect you when the going gets hard. And that's the other thing that I kept remembering. When you're going through a tough time, just keep going, because it eventually gets better. And you need a lot of courage when you're in medical school, because you're always you're always going to be out of your comfort zone. So medical school is a lot about getting comfortable, being uncomfortable. That's what I really took away from residency and medical school, was that was the thing that I learned, was that I was learning to get comfortable being very uncomfortable, right? French, a lot of your, internship year, a lot of the things that you're doing, you've never done before, you have no idea how to do them. You're always out of your comfort zone. It's the other reason that if you follow me on Somos or on my personal brand on Instagram, you know that I work out a lot. And I do that not only because it balances my mind, I enjoy working out, but I also like to practice being uncomfortable. And when I am working out hard or doing something physically active, I'm remembering that I can do hard things, and that I connect to being out of my comfort zone, and that it ends up being okay. So that's a lot of what medical school is just being uncomfortable, but getting comfortable with that feeling. So then I finished medical school, and I didn't know what I wanted to do. And I think some of you may go through that struggle eventually also, of do I want to do obstetrics if you end up liking women's health, or do I want to do family medicine? Because you can do family medicine with a focus on obstetrics, or you could do an obstetrics residency, and they're different. So family medicine in Canada was a 2-year residency versus an obstetrical residency was 5 years. It's 4 years in the United States, but it's 5 years in Canada. So I didn't really know, and I struggled for a long time. And the struggles were largely centered around, who I was as a person. And I'll share with you what I mean by that. But also, do I want to do 5 years? I think at that point, I was already a little bit tired. And the idea of 5 more years sounded like a lot. But when I asked myself about some of my core values and my core strengths, I came up with this, that I was really somebody who liked finding, problems and then immediate solutions. So, and I'm also somebody that likes to do more and think less. So I'll tell you why that helped me. In obstetrics, of course, there's thinking, and of course, there's a lot of different parts of the obstetrical discipline that could involve a lot of heavy thinking. But what I realized is that I liked being a surgeon because I liked the immediate problem solution. And I liked just, oh, here's a problem, let me excise it, let me remove it, let me operate on it. And I liked the kind of simplicity on some levels of obstetrics, because when basically it really came down, every situation came down to one question. Are we delivering this baby now or later? And I really liked how you could distill a very complicated scenario into one question. and versus family medicine or other disciplines where there's a lot of thinking through differentials or different situations. I tended not to enjoy that as much. So that was why I chose OB, even though it was another 5 years of residency. I also realized that I really liked women's health, and I really liked the concept of being present for a woman on her journey through her reproductive life. And that was really important for me. Whereas in family medicine, I could get that, but I wouldn't only have that necessarily. So I did my OBGYN residency, and I did it in French because the commitment to go to that French medical school was that my residency also had to be in French because I had to give service back to a French community. So I did my residency in French, and I really am very grateful to the patients at that hospital because they were very patient with me, because obviously I was not Francophone. So I, struggled a little bit with the language, and they were very patient with me in being understanding that French wasn't my first language. And so that was another 5 years, as I mentioned. And I realized during that journey that the group of women that I connected to the most, and the group that I really enjoyed the most and was like the most excited to work with, was the teenagers and younger girls. And so again, like, you'll see this theme in my presentation, and I hope what you think about in your own lives is like thinking about the themes of what gets you excited, because those tend to be the right paths for you. So what got me really excited was working with teenagers. And so I decided that I was going to apply to do a fellowship, which means an extra 2 years of subspecialty training just in pediatric and adolescent gynecology. So that's 2 extra years after you finish a residency in OBGYN that you can subspecialize just in treating girls under the age of 25. So I decided, so all of my residency was in Canada, and I had never lived in the United States before. And I decided to move here to pursue a fellowship. And that's when things got really hard. So medical school and residency was pretty darn hard, but it was not even comparative to the 2 years of this fellowship. So remember what I said, everything prepares you to be comfortable being uncomfortable. And I'm really glad that I went through the tough experiences that I went through to even get to medicine, let alone in my residency, because I didn't speak the language, because it all helped me to be really uncomfortable during my fellowship. Fellowship was really hard because we were on call all the time, and it was really busy. And there's definitely a different culture between work-life balance in the United States and Canada. That's 100%. And so it was really hard, and I moved here by myself. I didn't know anybody, literally packed a suitcase and moved. And so all of those things were challenging, but I wouldn't have traded those 2 years because I really enjoyed connecting with those girls. So then I finished my fellowship. So now I've done medical school, residency, fellowship. And when I was in my fellowship, I discovered this other thing that I really liked, which was science. And I really liked innovating, and I really liked medical devices and designing things. And so in my fellowship, I recognized that there was a medical instrument called the vaginal stent, which is like a device that we can place inside the vagina after girls have surgery, that we actually didn't have. It didn't exist for girls that were teenagers. And nobody else was really working on this problem. And I decided, why shouldn't it be me? Why don't I work on it? And I really enjoyed inventing things. But what you know about me is that I didn't have a science background. So here I was trying to figure out how to do hard things like invent a medical device when I had no science background. So I decided I needed one more degree. And I convinced the group at Baylor that they should hire me on and that they needed me to build up their science wing in pediatric gynecology, because at that time there wasn't anybody in pediatric gynecology that was really focused on science and innovation. And I basically gave them a presentation telling a story about why they needed me to be there to help them. So again, it's the same theme as when I did my interview for medical school, where I basically I told them a story about why they needed me in their French program, even though I didn't speak French. Same thing here. I basically told Baylor and convinced them about why they needed me to be there to do science, even though I didn't have a science background. So all that to say, you're the only thing that limits yourself. So I got a degree, I got a master's degree in like translational research and bench research, even though I had no science background. I got through that. That was hard. I had some great mentoring. This is the other thing that I hope you guys take away from this, is the power of a really great mentor, and that you should surround yourself, if you can, with people who see the best for you and who see paths for you that you don't even see for yourself. So the reason that I stuck with it and did this science degree and was able to convince Baylor that they should hire me as a scientist, even though I wasn't a scientist, is that I had some really great mentors who believed in me and saw that in me and convinced me to keep going. So I applied after I got my master's, and I was now working as a pediatric gynecologist at Baylor and doing my master's part-time. I finished my master's. I convinced them that they needed to not only pay for my master's, but keep me on. And then I applied for a couple of really big grants from the NIH, and I got them, even though I wasn't a scientist. And basically getting that kind of money protected me and allowed me to open my own lab. So I run a basic science lab, even though I'm not a scientist, and have been able to work as a pediatric gynecologist in running a basic science lab at the same time. And you can see how all of that happened, one thing after another. So I'll tell you just really quickly, it seems like we only have 10 minutes left. I'm seeing that, so I don't want to keep you guys too much longer. Some of the things that we're working on in my lab are around the vagina and how it heals. Obviously, I'm very passionate about women's health still. So we're looking at how the vagina heals. I'm still working on the vaginal stents. I do have a clinical trial that's going to start with the medical device that I invented in my fellowship with no background in medical devices. So that clinical trial, we're actually going to start recruiting patients in April. So that's pretty crazy. I'm also working on creating a vagina on a chip model, like other organs on chips, to see if we can test drugs more efficiently on a minimal functional unit that represents a vagina. And I'm working on 3D and virtual reality simulation to help other fellows and residents learn how to operate without having to actually touch a patient. And this is my lab. These are the ladies in my lab. So I have Jennifer and Giselle. So based on some of that grant money that I got, I was able to hire people to work in my lab. So we run a lab, we work on all these projects together. They're the scientists. I'm the medical person. And so between two scientists and one doctor, we figure out a lot of great things. So again, don't let anyone tell you you can't do things just because you don't have the background. You just have to tell a great story. So beyond the lab and pediatric gynecology, this is actually a Lego of a clinician scientist, which I didn't know they had a Lego of a doctor scientist, which is pretty great. I think you guys found me on So Much GYN. which again is it's a online gynecology platform that I started again because I like connecting to stories and I love advocacy, right? It all comes back to African studies and my father's journey and my journey. And I really feel passionate about giving Latina girls especially an understanding of their reproductive health, which is what I have seen in my patient population, that sometimes there's a lot of either misinformation or a lot of non-information, actually, that girls really struggle to get access to the same reproductive health information because of language differences, because of cultural backgrounds, or whatever the limitation might be. But my hope is that I could be able to at least provide the best gynecologic information and access to all of the options that might help them and their families make really great decisions, whatever those decisions might be for their best health. And also through that, I started and co-founded FemTech Focus, which basically is a not-for-profit or nonprofit that helps and connects women entrepreneurs, any entrepreneurs, women entrepreneurs, male entrepreneurs, anybody who's working in the femtech space with, resources and opportunities to accelerate their health designs, health ideas to better women's health. And then that's me outside of one of the labs at Baylor. This is like a lab museum. And so that was a more recent picture just earlier this year. So in the last 5 minutes, I want really for you guys to connect, most importantly, to this drawing. And if you don't know this, and I don't know if I'm pronouncing it correctly, Ikigai, but this is the one thing that I hope you take away from this entire presentation, is that this is the most important thing for you to find in your journey. And Ikigai is this concept of fulfillment. And where do you find personal fulfillment? Because it may or may not be through medicine. And it's this intersection, you can see it right here in the middle. It's this intersection of finding what you love, finding what you're good at, finding what the world needs from you, and ideally what you can be paid for. And where those things intersect is where you find fulfillment. And it may or may not be medicine. This is kind of the same idea, and I want to make sure I leave time for your questions. But basically, your life's goal should be about finding the world's needs that intersect with your passion. And these are the places that you can find me, either on Somos or my personal brand, Dr. Julie. I hope you listen to the FemTech Focus podcast, because it's a great one about women's health. And it also will help you understand that there are other options if you're interested in science, biology, women's health, entrepreneurship, making a difference, that all of those can be accomplished in other avenues besides medicine. And that people need engineers, et cetera, or entrepreneurs to make companies work for women's health. There's also a podcast from some of our interns that you guys might like. It's they're sort of younger ladies who started a podcast about just trying to make it in the world. And so what I want to conclude with is this, what I hope you've taken away from this is that people think life's journey is a straight line, and that you always knew you were going to get there, and that everything lined up for you perfectly. And what I hope you take away from this is that everybody's journey has a whole bunch of squiggles, and it's about connecting to the things that make you really passionate. And that was the end of that. And I don't know if you guys had any questions for me.
So we had a question on our Instagram.
Sure.
I'm just gonna ask you. So what age should someone start going to the gynecologist for checkups?
Oh, that's great. That's a great question. So by the kind of ACOG, which is our American College of Obstetrics and Gynecology, really 15, you should have your first gynecologic appointment. It doesn't necessarily mean you need an exam or a pap smear or anything like that. But really a check-in with a gynecologist at age 15 is usually recommended. Now, some girls come earlier because they, have issues with regards to their periods or other things, but yes, 15. I'm seeing other questions coming into this chat. If you had other questions about medicine, getting to medical school, what is it like? I'm happy to answer. I know we may get kicked off here, but if we do, I'm happy to answer you on any platform, whether it's email or Instagram or whatever is the most convenient for you guys. Somebody was asking, how long did your journey take? Well, it took 5 years of undergrad, because don't forget, I flunked my first year, so I had to go back. So 5 years of undergrad, 4 years of medical school, 5 years of residency, 2 years of fellowship in pediatric gynecology, 2 years to do my master's. So all of that after high school. So that's a lot. It was a long time. Okay, what else? How protected are females who get HPV at 21 years vaccine and do not know if the other partner male has gotten the HPV vaccine? So I'm assuming that you've gotten the 9-valent vaccine. That would be the most recent one. And so if you've gotten all 3 boosters, you are relatively protected. It's a great vaccine. It does work, even if your other partner or you've had one partner or more than one partner, and whether or not they've had the vaccine, we've seen definite reductions. And this vaccine's been around for a